The first baby born through IVF was back in 1978. So we can understand that today a lot of children that were born through IVF have become grown-ups, have become adults, and we can do a lot of studies that can compare the health issues that might have in comparison to children coming from spontaneous conception. Indeed, there have been a lot of studies in many different countries in the world that are trying to find an answer to this question. There is a very well-known study regarding ICSI, which is a variation of IVF that is usually used for low sperm counts, that has associated actually children coming from ICSI with a higher rate of autism. But this study has never made it clear if this increase is really biased or not, if it is associated to the assisted reproductive technology or to the fact that, for example, couples that seek IVF might be older in age. All the studies that have been done is very difficult to say if they are biased or not. For example, there was a few years ago a study that linked IVF with children that have increased rate of high blood pressures problems. But again, there is no clear answer if this is related to the IVF procedure itself or it is related to health problems that the parents might had, like obesity, like again increased age or any other problems that can lead to increased blood pressure and increased resistance to insulin. In Sweden, there was recent a very big study that showed that children coming from IVF might be in increased risk of death in the first year of after the birth. And especially when that IVF was done with frozen embryos. Again, though, this study cannot make it clear if this is the case or this is associated to multiple pregnancies, because we know that IVF can cause multiple pregnancies. This can be related to low birth weight, can be related to prematurity, and all those things might be the reason that there is increased risk in the first year after the birth. The same thing with some studies that have showed increased birth defects. Can these birth defects related to the assisted reproductive technology itself, or because these children came from parents of older age? In Israel, which is a country that is very good for this sort of studies, because girls and boys go to the military service there, and also there is computerized technology that keeps records of all the medical issues that someone may experience in life. There was a study that actually showed that children coming from IVF actually scored higher in cognitive scores and in IQ scores, and actually did not have more health issues in comparison to children coming from spontaneous conception. The only difference was that they were seeking more appointments during their lifetime, but this can be related to their parents and the fact that they might asked for medical assistance more often because of the fact that they used IVF. Generally, all the studies have not shown any clear evidence that there are increased risks for children coming from IVF.